Hello and welcome to a 6-month Smiles info webinar. My name is Stephen Incontrera. I am the content marketing manager over at 6-month Smiles. And tonight we have a 30-minute informational webinar just to show you one thing that dentists are buzzing about when it comes to short-term ortho and a system that can really benefit your practice. And I could not have a better presenter tonight. Tonight we have Dr. Chris Bowman with us, who is not only a 6-month Smiles clinical instructor, but he's also one of the best and the brightest when it comes to dental marketing. So he really does have a passion for this stuff, and not only can he show you how this system will be great for your practice, if you choose to go to one of his courses, he will show you how to implement it very strategically and scientifically. So without further ado, I'm going to pass the baton to Dr. Bowman, and after you, sir.
Thank you, Stephen, and I hope everyone out there is doing great tonight. I appreciate that introduction, and I appreciate the kind words. My name is Chris Bowman, and I am a general dentist in Charlotte, North Carolina. Have a full-time practice, and I work Monday through Thursday. And also, too, I teach 6-month Smiles courses. I am a level 1 clinical instructor. Been doing that since 2011. And I've been doing 6-month Smiles in my practice as a procedure since 2009. So I've had great experience with this procedure. It's been a wonderful thing for my practice. And tonight I will be sharing with you why over 100,000 patients and counting are smiling with confidence thanks to 6-month Smiles, and how you can have a piece of that action in your own practice. So let me go to the next slide real quick here. There I am. Again, my name is Chris Bowman. The one thing I'd like for you to write down before we get started is my email address. So if you look at the bottom of the screen, you'll see my email address. It's chris@dentalinsiders.com. Go ahead and jot that down, and I welcome you to ask me any questions you may have about this webinar or about 6-month Smiles in general. Of course, we're going to give you some links if you're interested in registering for one of the courses at the end of the webinar, but feel free to shoot me an email if you have a question about something after the webinar is over and maybe you forgot to ask. Also, I want to reinforce what Stephen said about the questions box. Somewhere on your widget for go to webinar, you will see a questions box, and I'd recommend that you enter any questions in there. Whenever they come to your mind, just enter those questions. I will answer them toward the end of the webinar. I just want to be able to get through this content in a timely manner so that I can respect your time and we can get through all the content, and then I'm happy to answer your questions. Okay. Oh, there's my family as well. My wife, Elizabeth. As you can see, I married up. So that's Elizabeth there in the upper left picture, and also actually 3 of the pictures, she's right there, along with my 2 sons, Reed and Keenan. Reed is on the left in the lower left photograph of us at Fenway Park. We're big Red Sox fans. And Keenan is on the right. Both of them big baseball players and good athletes. And Olivia, our 10-year-old daughter, she loves to ride horses. That picture up on the top left, top right, excuse me, is us dropping her off this summer at Camp Marywood in Western North Carolina. So I live in Charlotte, North Carolina. So let's get right into the content here, and let's talk about 6-month Smiles. Now, all of you have probably heard of 6-month Smiles before. Some of you may know more about it than others. So I just want to give you a few general principles, and then tonight I'm going to discuss some basic facts about 6-month Smiles. Now, some of these facts might be things that you already know. Some of these facts are going to be what I call myth busters. They're going to bust up some common myths about short-term orthodontics. So let's first start with our core belief. And this is really deeply held in my heart as a general dentist and as a private practice dentist. I believe that everyone that comes into our practice and everyone that comes into your practice should smile with confidence. They deserve to smile with confidence. Now, whether they choose to do so or not is certainly up to them. But we believe that everyone deserves to smile with confidence, and we also believe that every dentist can help. And what you're going to find out tonight, if you don't know already, is that general dentists can do orthodontics. It is not some kind of mysterious, nebulous thing that you can't know about. Matter of fact, I had no bracket and wire experience when I started my 6-month Smiles journey. And the only reason why I'm an instructor isn't because I'm the best at brackets and wires. It's because the system is really simple. and it's very easy to implement. And I know that you can do it. If I can do it, I know you can do it. So straight teeth, less time, clear braces, that's one of our taglines with 6 Month Smiles, and that's exactly what you can provide for your patients in your practice. You know, another thing I like to say before I move on is I want you to think about this. This is the motto in our practice, is to give everyone the opportunity to say yes or no to your best care. So this fits right in with that model. So we want to be able to give our patients the opportunity to say yes or no to what we can do for them. In order to do that, we have to let them know what we can do for them. And this is just one of those things where patients don't know that we can do this. So hopefully you'll decide to take the course, and after the level 1 course on Monday morning, you'll be able to do this for your patients. And there's definitely no better time than right now to consider doing this. Every year, more and more adults engage in adult orthodontics, not just at the orthodontist, but also with short-term options as well. Now, many of you, of course, have heard of aligners, but the fastest growing segment in orthodontics right now is short-term orthodontics, and 6 Month Smiles is the flagship leader in that industry. So more than 1.2 million adults in the US received orthodontic treatment in 2012. It's 5 years ago. And that's up 39% from 1996. So we don't have any hard data since then, but I would venture to say that now in 2017 and 2018, my guess is we're probably up 25 to 30% from 2012, if not even more. So think about that. 4.65 million orthodontic procedures performed for patients aged 17 and younger in 2012. So, and that's up 32% as well. So if you do the math there, it looks like, you know, young adults or teenagers represent about 80% of the orthodontic market, whereas adults represent about 20% of the orthodontic market. So there is still a huge upside opportunity in the ortho market for adults in the US. Now, of course, when you go into your practice and your patients come in to visit, you see patients that look like this. What I like to say is, if the teeth aren't straight, then they could be. So most of your patients that come into your practice probably still have either crooked or spaced teeth. Maybe they used to have straight teeth and they didn't wear the retainers, and now those teeth have shifted and you have an ortho relapse case. So I would venture to say that in the typical general practice that sees anywhere from 15 to 20 patients a day, there are probably, let's say, 75% of those patients who could potentially be candidates for adult orthodontics, at least half of them. So if you present the opportunity to half of your patients every day, then it's very likely that one of those patients may say yes. So I just want you to think about the opportunity that's there. All your patients that have crooked teeth or spaced teeth, many of those patients will be candidates for 6 Month Smiles. Not everyone, but many of them. In fact, about 80 to 90% of your adult patients that have crooked or spaced teeth are candidates for 6 Month Smiles. Now, during the course, we help you differentiate which cases are best to treat versus the cases that are best to refer. So we go through all that with you, but I just want you to know that most patients are candidates. So in these particular cases here, how would you treat these patients now in your practice? If you would prefer to treat these patients with aligners, I would venture to say that in each of these 4 cases, you would have a very difficult time achieving some of the intended or desired results using aligners because of the limitations of aligners with regard to tooth movement. Now, I've been doing aligners in my practice for 16 years. So I'm very comfortable doing aligners and I've done hundreds of cases, but I also know the limitations of aligners. When I teach the 6 Month Smiles course, about half of the crowd, half of the dentists in the crowd have been doing aligners for a number of years, and they're pleased with some aspects of the aligner system and they're frustrated with other aspects. Well, I can tell you that 6 Month Smiles addresses the areas that give you frustration with aligners. So I recommend that you actually offer both in your practice. And when you start with 6 Month Smiles, you can do just that. So let's look at exactly what 6 Month Smiles is. It's a short-term orthodontic system that provides general practitioners with a practical and turnkey solution for adults with crooked teeth. One thing that we also offer with 6 Month Smiles is digital treatment planning provided by orthodontists. 6 Month Smiles has a stable of orthodontists that can actually help treatment plan your cases for you if you choose to do so. And it's a wonderful service that we've been offering now for about a year. It's been very popular for our providers. The bracket seating system, which I'll show you in just a moment, involves what we call a one-step bracket seating system with all the brackets pre-positioned in vacuum formed trays. So you can seat an entire arch of brackets in one step. It's really cool, easier than hand placing them yourself. Also, the wires that we use are very easy to use. They're nickel titanium wires. They provide a very low force for tooth movement. And another thing about that is that teeth do not require heavy forces for them to move. In fact, some studies show that teeth move a little faster when you use light forces, light, steady forces. The nickel titanium wires that we use provide light forces, and they don't require any bending of the wires. As a matter of fact, when you bend the wires, they actually regain shape on their own. Also, the brackets that we have are clear brackets that blend in with the color of the teeth, and they are designed specifically for short-term orthodontics. The prescription built into these brackets is designed specifically for rapid tooth movement with low forces. And this program and the system is designed specifically for GPs, and so that we can address the patient's chief complaints in about 4 to 9 months. Now, the reason why it's called 6-month smiles is because the average treatment time is about 6 months. But you'll find when you do your cases that some cases may be done in as quickly as 3 or 4 months. Most of your cases will take about 6 months, and there are some cases that may take 7, 8, or even 9 months. Now, I've had cases that are more complex that have gone even longer, but patients know that going in. But you want to start your cases, you want to start with cases that are going to be finished in an average of about 6 months. And during the course, we can go through case selection criteria with you in great detail so that you feel very comfortable with your first half dozen or dozen cases or so. So let's look at the definition of 6-month smiles. Now, short-term orthodontics, and 6-month smiles in particular, is cosmetically focused orthodontic treatment for adults that's performed in less than 9 months using clear brackets that are very unique to 6-month smiles and tooth-colored wires. So it's a cosmetic orthodontic system that has cosmetically focused goals. So as you can see here, the brackets are clear and they blend in with the dentition, and the wires are tooth-colored. And the bands that we use to ligate the wires into the brackets are also clear. So everything is very clean, very aesthetic, and it's designed to work very quickly. Now, this case here is Mia. She is she's a typical 6-month smiles case with crowded teeth, and her chief complaint was this tooth right here. Was tooth number 8. She called it her front tooth, her front tooth that sticks out. So she actually has 2 front teeth, as you can see, but we were able to match them up very nicely in 6 months with the 6-month smile system. So one very important point too about 6-month smiles is that it's not designed to be a replacement for comprehensive orthodontics. The difference between the two is the goals of treatment. The goals of treatment for comprehensive ortho, as they're expressed down here, are a class 1 molar and canine relationship, ideal overbite and overjet as defined in orthodontic textbooks, and then ideal root positions. Now, these 3 things are 3 of the things that often cause ortho cases to last 2 years on average, because orthodontists are focused on providing those extra and more complex movements to achieve those objectives. With 6-month smiles, we're not necessarily trying to achieve all of those specific objectives with each case. What we're trying to do is help patients achieve a symmetrical and attractive smile in an average of about 6 months or up to 9 months with these brackets and wires. We're not necessarily focused specifically on gaining a class 1 molar or canine relationship. We're not always specifically focused on achieving ideal overbite and overjet. Now, I would also say that many times the cases that you get back from the orthodontist don't necessarily have ideal overbite and overjet either, do they? Well, there's a reason for that. Many times you can't achieve it with even conventional orthodontics. And sometimes even ideal root positions aren't necessarily possible with conventional orthodontics. So what you'll find with 6-month smiles is that many cases that we finish will actually rival the results that you can get from an orthodontist. And there will be other cases where the final results might look slightly different. But one of the things that we tend to do as dentists is we tend to compare the results that we get with what our vision of perfect is, or our vision of ideal. Well, the patients don't think that way. Our patients think in terms of comparing their results to the way their teeth used to be. So if you think about it that way, I mean, if you look at the picture on the left and then you look at the picture on the right, which one's better? Well, it's really clear that the picture on the right is much better. Well, an orthodontist might look at the picture on the right and might find a couple of things that he or she doesn't think may be perfect or ideal. Well, the patient doesn't often care about those things. And one of the things that I help use to determine whether I might want to refer a patient to an orthodontist or treat the patient in my office is by asking them this question. How important is it for you to have your teeth in the absolute ideal positions? And what you'll find is about 80 to 90% of your adult patients, they'll look at you and they'll say, you know what? I don't need them to be 100% perfect. I just want them straight. Those patients are almost always ideal candidates for 6-month smiles. So just remember that question. How important is it for you to have your teeth perfectly straight or ideal? And they'll often say, I don't need them perfect. I just want them straight. So let's look at what kind of cases we can treat with 6-month smiles. And again, it's not simply designed for minor tooth movement. It's the goals of the treatment that are a little bit different. So we can treat many cases with 6-month smiles. Overlapped, crowding, rotated teeth, high canines. And we all know, if you've done aligners, that it's really difficult to treat high canines or teeth that need to be extruded with aligners. We can correct anterior crossbites. We can even correct simple posterior crossbites. We can close spaces. We can treat open bites. We can level gingival margins. We can treat deep bites. 6-month smiles is a wonderful way to treat deep bite cases. We can super erupt teeth. We can round out arches for future cosmetics to make our cosmetic preparations a lot more conservative. Most patients are candidates, like I said before. And here's the bottom line question. If we can solve the patient's chief complaints in a reasonable amount of time, the patient is a good candidate for 6-month smiles. So in that vein, we do call it chief complaint orthodontics, because that's what we're aiming to correct. We're aiming to correct the patient's chief complaints. So one thing that I will do is I will put my patient's photographs up on the screen and I'll say, what would you change about your smile if you could? And their answers to that question are their chief complaints. So in this case, for example, the chief complaint was crooked teeth and high canines on the top. And if you'll take a look, you'll see that in just 5 months, we were able to achieve a result that the patient was very happy with. Now, if you're looking at this picture, I'm sure you can tell that tooth number 8 is not quite in the perfect position. Well, this patient was so ecstatic that the canines were brought down and that everything was lined up nicely that he decided he just wanted the braces off and he was ready to go. So I actually encouraged this patient to stay in the braces for another month or so to level those incisal edges. But this patient really was ready to go and wanted the braces off and was happy as could be. So it's very important to understand that oftentimes your patients have a different perspective about their teeth and their smile than you do. So you always want to remember that patients don't think like you do. And many patients are very happy with a result that we may not consider to be perfect. And that is exactly why 6-month smiles has been so successful. Now, I also want to emphasize that we never try to achieve anything less than our absolute best results. Sometimes, though, our patients drive that result. So if our patients are eager to get the braces off and they're happy with it and we've achieved the clinical objectives, then it is perfectly fine to remove the braces at that point. I mean, if you think about it, look at where this patient started. And imagine if this patient had never started orthodontic treatment, that's where this patient would be today. Is this better? Yes, it is. It's much better. So that's the point, is you want to achieve the absolute best result that you can, but also we understand that we're not always trying to achieve clinical perfection. And if you can take your perfection hat off, you could be wildly successful with 6-month smiles. And I will also say once again that you can achieve very excellent results with 6-month smiles that in many cases do look clinically ideal. Okay, here's another case. This is Mia in a little bit more detail. You'll see that these are month-by-month photographs of Mia's dentition. And there she is before braces on, and then with braces on, you can see how the wire is bent. When it has to go into the brackets, the wire has to bend to go into the brackets on the crooked teeth. Well, as the wire regains its shape, it's going to bring the teeth along with it, and the teeth will eventually get straight. And every month, every successive month, you can see that the wire is getting straighter and straighter and straighter. And then at the end, with braces off, we've achieved a really nice result for Mia, and she couldn't be happier with this type of result. As a matter of fact, during the 6 Month Smiles course, you will get to see a video of Mia before, during, and after, and she is amazing. She really shares her personal feelings and her emotional reaction to her smile before, during, and after treatment. It's really a wonderful video for you to watch. So here's some facts about 6 Month Smiles that you need to know. Fact number one, general dentists can perform this. I know that many of you in school were told you can't do ortho, you can't do braces, or you shouldn't do braces. For some reason, they made it some kind of a, magical, mystical territory that you just don't want to go into. Well, I can tell you that it's not that complicated. Most dentists who attend the course have very little or even no previous orthodontic experience. At least 75% of the attendees in each course have zero bracket and wire experience. We can really make it easy to understand, make it simple, and demystify orthodontics by breaking it down to its basic components. As a matter of fact, it literally takes me less than 20 minutes to explain the mechanics of brackets and wires. It's very simple and easy to understand. Now, the 2-day course will show you everything you need to know to start your cases and to help get it started in your practice from a marketing standpoint. That's one of my major focuses during the course. The 6 Month Smiles patient tray kit and Confidex digital treatment planning allow for making the procedure very streamlined and easy. And again, if you choose Confidex, you can actually have 6 Month Smiles orthodontist treatment plan the cases for you, which is really, it's a nice way to get started. Now, general dentists have really thrived with 6 Month Smiles over the past 10, 11 years. Currently, there are almost 9,000 providers worldwide for 6 Month Smiles. And I would say that I believe there's about 7,500 in the United States. So, in different countries throughout the world, I believe it's at least 30, 40 countries, there are 6 Month Smiles providers. The UK is the #2 country in the world for 6 Month Smiles providers, and it is growing into more countries every year. So if you can look over there on the left, you'll see what the bracket bonding trays look like. There's a hard, rigid outer shell and a softer inner liner that carry all of the brackets inside. And when you apply the etchant and bonding agent, you bond the brackets with these trays to the teeth. This system itself is very effective. The clear braces and tooth-colored wires provide a very efficient means of tooth movement in a very short period of time. Patients, adult patients especially, they want their braces to be off about as fast as you put them on. So the 6-month treatment time is very effective for adult patients. One of the things I say to patients is, how quickly your cleanings seem to come up. You get your teeth cleaned, and then next thing you know, 6 months has gone by and it's time to get your teeth cleaned again. Well, during that time period, your teeth could get straight. And when you put it in those terms, patients really understand how quick this can go. So it's really easy to explain to patients that it's a very fast procedure. And also the cost is lower than conventional orthodontics. Let's look at fact number 2. It is very reasonable and very realistic to finish cases within 6 months. Our goal is, again, not to achieve an identical result of comprehensive ortho within 6 months. The types of movements that orthodontists make with conventional brackets and wires typically take 18 to 24 months. Root torquing and bodily movement of teeth in many cases, it takes that long. So that's the reason why there is still a prominent place in orthodontics for traditional orthodontics. I mean, that is the flagship procedure in orthodontics. 6 Month Smile serves as an alternative to comprehensive orthodontics for adults that want straight teeth in less time. So what we focus on is leveling, aligning, and rounding out the arches or closing spaces in space teeth cases. So we teach case selection during the 2-day course so you can help determine which cases are best for you to treat in which cases are best for you to refer. And one interesting thing about that is that since I started doing 6-month smiles cases, I actually refer more cases to the orthodontist because, number one, through my marketing, I'm getting more patients in my practice who are seeking orthodontic care. Number two, since orthodontics is on my brain all the time, I'm recognizing more opportunities for orthodontics and more situations where orthodontics would be advantageous for a patient. And therefore, in those cases where it's best to be treated by an orthodontist, I am making the referral. So my orthodontists actually like me more than they did before I started doing 6-month smiles. Now, many of you may think it'll be the opposite. You may think that they're going to think that you're going to become a competitor. Well, I would venture to say that you can certainly work alongside your orthodontist just as well, if not better, when you become a 6-month smiles instructor. Let's look at one more case here. This is Linda. And if you look over there on the left, you'll see the before pictures. And then in the middle is with the braces on. That's the braces on appointment. And you can see how the wire meanders through the brackets. Now, a bent wire, when it goes through those brackets, will begin to regain its shape over time. Now, we do some interproximal reduction, and we do some other things to help the teeth move faster with light forces. Now, you can see on the right, with her case being finished, what a beautiful result we were able to achieve in just 6 months. Now, if I told you that Linda had gone to the orthodontist and spent 1.5 to 2 years with braces, and she came into your practice and looked like that, you probably wouldn't be too surprised, would you? I mean, that's a really nice result. Now, and some of you might say, well, yeah, the midline's off by about 1 millimeter, but you know what? That's still an excellent result. And we can achieve this in about 6 months with 6-month smiles. Now, if you look at the middle picture here on the right side, you'll see that there is a fixed bonded retainer that is carefully bonded to Linda's front 6 upper teeth. We recommend bonding retainers to the upper 6 teeth and the lower 6 teeth, and also wearing clear aligner style retainers as well at night. So that's one of the things that we teach in the course. Here's another case, Patricia. And again, you can see that she has a very deep bite. Now look at how deep her bite is preoperatively. And then post-treatment, you can see that in just 6 months, not only were we able to align her teeth, but we were also able to give her a much more pleasing and attractive smile. And look at how much we corrected her deep bite. 6-month smiles does a wonderful job of leveling the arches as well as aligning the arches so that you can get a result just like this in about 6 months in your own practice. Now, some of you may be looking towards your posterior teeth and thinking to yourself, you know, wow, she needs some dental work. Well, I can tell you she does need dental work. But another thing about 6-month smiles is that it gets you to rethink your sequencing with regard to dental treatment. Now, many of you have had patients, I know every one of you, have had patients that have waited longer than 6 months to get their dental work done. Well, during that 6 months, their teeth could be getting straight. And what you've probably found in your practice is that once patients' teeth look better, they begin to take better care of them. So when Patricia's teeth got straight, all of a sudden she became hyper-focused on wanting to get them fixed. So then we were able to complete the posterior dentistry after getting them straight. Now, also too, with her teeth being straighter, her occlusion is in a better condition and in a better position, so that when we do crowns, for example, the occlusion for those crowns will be better than if we had done the crowns before starting orthodontic treatment. So here's the 6-month smile system with the indirect bonding trays. So as you can see, they're divided into half arches. So when we teach the braces on appointment, we actually teach that you bond both halves at the same time. The reason why they're provided in half arch trays is because even with the most crooked teeth, half arches will bond with no problem. If you were to try to bond a full arch when the teeth are really crooked, many times the bonding trays wouldn't go on the teeth very easily. So by cutting the trays in half, we're able to easily bond a full arch at a time using a very simple protocol that we teach in the course. As a matter of fact, my dental assistant does about 80 to 90% of this, and I only do the parts of the procedure that I'm legally required to do. So it makes for a very efficient procedure for the patients, less doctor time. So doctors, you can spend more time with your patients in another room doing more productive dentistry while you're also being very productive with 6-month smiles. The patient tray kit includes just about everything you need to do your 6-month smiles cases. What this does is it lowers your stress during each case because you pretty much have almost everything you need to do the cases. During the course, we go over with you what you need to complete your 6-month smiles cases. So let me go through this stuff with you real quick. You get the bonding trays that are on the models of their teeth. You also get quick ties and ligature ties that help attach the wires to the brackets. You also get your 6-month smiles lucid lock wires. You even get a little bottle of bonding agent, which is really nice. This is All Bond Universal from Bisco. You get interproximal strips to help reduce in between the teeth, interproximal reduction. You also get a little bender brush here for your bonding agent and orthodontic wax. Now you'll also need a very small inventory of supplies. We have a cart in our practice. We have actually 2 carts in our practice that have all the ortho supplies, and we go through all that stuff in the course. It's very easy. You do not need to create a whole new closet in your office. You can do everything on a very small little cart that has more than enough stuff for you to complete your cases. The ability to delegate most of the procedure really increases your profitability and makes things a lot easier for you in your practice. Now, Confidex is a really cool development with 6-month smiles over the last year. This allows us to help you treatment plan your cases. And again, these are orthodontists that have been hired by 6-month smiles to help treatment plan your cases. So it makes your cases more predictable, and it also helps answer some of those questions you may have about how to approach your cases. Now, again, during the 2-day course, we teach you the methods and the techniques and the approaches on how to treat the 6-month smiles cases that you'll be treating in your practice. Excuse me. As a matter of fact, up until a year ago, all 6-month smiles providers treated all of their cases pretty much on their own, except for the fact that we do have access to a wonderful online forum where you can post photographs and questions about how to approach certain situations with regard to your cases. But since the launch of Confidex, you're able now to post your cases to Confidex and submit them to Confidex for treatment planning services. So the orthodontist at Confidex will treatment plan your entire case for you. They will give you a step-by-step treatment planning guide. They'll show you the digital bracket placement plans. You can even approve that, or you can make suggestions to improve that if you like. And then you'll also get a 3D simulation that shows the patients the before and after and how the teeth will move on a month-by-month basis. So with regard to submitting cases through Confidex, you get all of these services and all of these features here. It's planned by orthodontists. You get a 3D simulation of treatment movements. The bracket placement is digital, which actually, by the way, is going to be coming very soon for standard PTK patient cases. Also, you'll get specific directions for each appointment in the follow-up process. Also, how much interproximal reduction to do and where you want to put bite guards to help keep patients from hitting their brackets and also help the teeth move faster. Also, all of these other details are provided with Confidex. Now, if you choose not to use Confidex treatment planning services, that's perfectly fine. But with that, you'll get all the standard PTK services that have always been provided with 6-month smiles. You'll get the bonding trays, the adhesive, the arch wires, the ligature ties, the relief wax, quick ties, and Optrogate retractor, which is wonderful to use with these cases. So let me show you, I'm going to show you each one of these photographs on a separate slide so you'll be able to see them a little more clearly. So this is the diagram that you'll get as a part of your Confidex treatment plan. So each of these little symbols represents something that will apply to your case, whether it be using elastics, as you see here with the little blue circles and the simulated rubber bands. The green spaces here is where you'll perform interproximal reduction, and when it tells you when to do it. The red crosses signify bite guards. So in many cases, you have to apply bite guards, one on each side, to keep patients from biting down on their brackets. And an interesting thing about the bite guards, it also allows the teeth to move faster. And even though it does feel a little weird for the patient for the first month, it does allow their teeth to move faster, and patients tolerate this very nicely. All you have to do is tell your patients this will help your teeth move faster, and they will happily do it because they want their teeth to be straight very, very quickly. You're also going to get a very specific month-by-month instruction sheet on exactly what to do each month throughout the procedure. You can see here that this particular case is higher on the difficulty scale. It's actually extreme on the difficulty scale. So we wouldn't really recommend that you begin a case that's this high on the scale for your first case. But even if you were to submit a case like this, you're going to get month-by-month instructions that walk you through the entire process. Also, there are going to be some special considerations that you need to think about for each one of your cases. So all of these considerations and requirements help you through your case. It helps make it easy, predictable, and also much easier on your patients. This is what the 3D simulation looks like with Confidex. It's really nice because it gives you a great visual of what it looks like with the patient's brackets on their teeth. Now, it also shows different views as well. So you can look at the teeth from the occlusal view, and you can also rotate the brackets in any direction. It's a 3D STL file. So you can move it around and you can evaluate how the brackets look. Now, I know in this particular 3D simulation, because of the coloring, the brackets look really large. Now, they're not that large on the patient's teeth, but this 3D simulation gives you an idea about how you can analyze the bracket position, and you can really determine if the brackets are in the right position. So here are the other views, and this occlusal view does a really good job of showing you the angulation of the brackets so that if you want to make any adjustments, you can do that. And during the course, we also show you preferred bracket positions for different situations in your cases. It also shows you how the brackets are digitally placed for accuracy. So you know when you get your case back in those bonding trays that those brackets are going to be exactly where you want them to be. So the brackets are printed onto 3D models. These 3D models are printed at the 6 Month Smiles facility, and these little templates here are the templates that allow the brackets to be slid into place. So there is absolutely no way that those brackets can be positioned incorrectly once these guides are in place. Now, when you get your bonding trays back, the guides will not be a part of your brackets. The bonding trays and the brackets, that's all that'll be there. These guides are only on the models of the teeth to aid them in bracket placement for each case. And again, this is what the files will look like, and you can view this and approve it or make changes to it. The whole process is very quick, and in most cases you'll get your brackets back within 2 to 4 weeks from submitting the case. If you're submitting digital impressions, you'll get them back even faster. Let's go to fact number 3. Short-term movement does not cause root resorption. Now, this is a big myth buster. The first question I usually get when I teach each course is that short-term ortho will cause root resorption. Well, the research actually shows the opposite. Root resorption is shown to be caused when heavy forces are applied over a long period of time. With 6 Month Smiles, we're applying relatively light forces over a short period of time. So we're not moving teeth any faster than what typically happens in the first 6 months of conventional orthodontics. We're doing tipping, rotational movements, aligning, and closing spaces. Root resorption is usually associated with heavy forces over a long period, like I said before. It's also associated with bodily movements. And in 6 Month Smiles, we do less of that. We're also using the light force wires, like I mentioned before. So if you wanted to discuss this further, I would actually argue that comprehensive orthodontics can be quite a bit more force and would be much more likely to cause root resorption, especially with intrusional and significant bodily movements. Fact number 4, 6 Month Smiles is profitable from day one. I would say from day one that your first patient accepts the case, you will be profitable. The average investment to get started in 6 Month Smiles, including course tuition, tuition for 2 or 3 team members, travel, plus all the supplies and inventory you need, is probably, it says $4,500 here. I would say somewhere between $4,500 and $6,000, somewhere around there. That's to get everything you need and even to do a little bit of marketing. So with that small investment, if you imagine that the average case size is between $4,000 and $4,500, you're going to recoup that investment on your second case. You know, it's kind of like there's an amusement park here in Charlotte called Carowinds, and they sell a daily ticket for, I think it's $45. Well, they sell a season pass for $80. So the season pass is less than the cost of 2 tickets. So of course everybody buys a season pass. And if you go to Carowinds twice, you've already gotten your money's worth on the season pass. So in this case, when you begin your second case, you're already profitable with 6 Month Smiles. So just remember that it only takes 2 cases to become profitable with 6 Month Smiles. Your case fee is $5.99 for a PTK case. For Confidex, I believe it's $7.49. So again, very reasonable case fees to get started with 6 Month Smiles. Also, remember, doctors, your dental assistant, who is also trained, who also should be trained with 6 Month Smiles, could be in the other room doing most of your 6 Month Smiles cases while you are in another room. Maybe you're prepping a quadrant of Crown and Bridge. So you can remain profitable in one room while also being more profitable in the 6 Month Smiles room. So you can typically add at least $10,000 to $25,000 to your monthly production if you do anywhere from 2 to 5 cases a month. Okay. Fact number 5, 6 Month Smiles is the leading brand in cosmetic orthodontics. Of course, many of you have heard of Invisalign, and they are no doubt the leader in aligner technology. 6 Month Smiles is by far the leader in short-term orthodontics with brackets and wires. Been around since 2006. We have close to 9,000 providers now worldwide. Actually, it's over 50 countries. That was just updated. And again, over 100,000 patients treated with 6 Month Smiles. And you can have a piece of that pie. All you have to do is get started. Fact number 6, and this is actually the best thing. If you think about this, how many times have you been to a course that was great, but after the course was over, next thing you know, there's no support? You know, you go back to your office, you're all eager to get started, and then it just kind of dies. If that's ever happened to you before, and it's happened to me, well, rest assured that will not happen with 6 Month Smiles, because the 2-day course is where your journey begins. It's not where it ends, because after you come back from the course, you have unlimited case support. We have an amazing online provider resource center where you can go to get advice on your cases. There are over 30, actually close to 40 now, mentors and instructors just like me who are available to assist you with questions about your cases. We have webinars on a monthly basis called Jumpstart webinars or advanced level webinars that walk you through certain types of treatments, certain types of 6 Month Smiles cases, and different aspects of the 6 Month Smiles procedure. Also on the Provider Resource Center is a free educational center that includes the entire 2-day course in short video form, meaning every module of the course is broken down into 2 to 5 minute videos. So if there's something about the course that you can't remember or something you want to share with your team, you can actually go and watch the entire course segment by segment on the Provider Resource Center. You can watch all the hands-on videos from the 2-day course. You can also watch any previous webinars that we've got archived on the forum. Also, we have marketing resources available to you on the Provider Resource Center as well. Any of the forms and documents that you need for your practice, including informed consent, insurance forms, quick treatment planning forms, all that stuff is available on the Provider Resource Center. There's also a Find a Dentist feature for patients. So if people are searching for a dentist who does 6 Month Smiles, you will be listed on the Provider Resource Center so they can find you. All they have to do is enter their zip code, and if you're near them, you will pop up on the screen. And there's so much more that that Provider Resource Center offers you as a 6 Month Smiles provider, and this is all available for free. Now, there are some products available for purchase on the Provider Resource Center, but membership in the Provider Resource Center and just about everything on there, including some of the basic marketing materials, are all free. You just pay for shipping on those materials. So again, let's go over the 6 facts that you want to know about 6 Month Smiles as we wrap it up. And we're going to give you an invitation to go to one of the 2-day courses that's coming up soon. Remember fact number 1, general dentists can perform orthodontics. I know most of you probably got almost no orthodontic training in dental school. Well, in 2 days, we can have you ready to start your first cases with 6 Month Smiles, and you'll just get rolling from there. It is very reasonable and very realistic to finish orthodontic cases within 6 months using the 6 Month Smile system. Remember, the goals of treatment are a little bit different than they are with comprehensive orthodontics. If you ask your patients, How important is it for you to have your teeth in the absolute ideal positions? I guarantee you that 4 out of 5 of those patients, maybe even more, probably about 90%, will say something like, hey, I don't need them to be 100% perfect. I just want them to be straight. Those are your best candidates for 6-month smiles. Short-term movement does not cause root resorption. That's fact number 3. Just remember that light forces provided over a relatively short period of time cause less of a risk for root resorption than heavier forces over a longer period of time. Fact number 4, 6-month smiles is profitable from day one. I would say that if you register for a course, that course is going to be in the near future. If you start telling your patients what you're going to be able to offer for them in a couple of months, or maybe even in a month, then your patients will begin to ask for this procedure. Many of the providers that come to a 2-day course already have 2, 3, 4, 5, or even more patients lined up, ready to go the next week. If you plan this correctly, you can become profitable less than 1 week after taking the 2-day course, no question. Maybe even after day 1. Fact number 5, 6-month smiles is the leading brand of cosmetic orthodontics. I think we've established that, and we have by far the largest number of providers. We have by far the best level of support in the industry. I can't think of anyone else in dentistry who offers you more support after the course than 6-month smiles, and there is no one that can compete with us there. And that's probably the most important aspect of 6-month smiles, is the lasting, ongoing support that you get as a provider. You will never feel like you've been left out in the cold all alone to figure this out all by yourself. So we're here to help you every step of the way to help you be successful with 6-month smiles. We offer unlimited clinical and educational support. Like I said, there is no reason why you cannot be successful with 6-month smiles. So knowing this, let me ask you a few questions. What if you could give more of your patients an opportunity to improve their smile? What if you could give them the opportunity to say yes or no to a solution like this? What if you could change just one patient's life per month? Just one per month. What if you could make money doing it? Now, with an average case fee of $4,000 to $4,500, even if you just treated one patient per month, you're going to add close to $50,000 a year to your revenue in your practice. Now, there's no reason why you can't treat one patient a week. Or if you really got your team involved, and if your team got excited, enthusiastic, and interested in this procedure, then they are going to be more likely to drive this in your practice. They will bring it up to more of your patients every day. What if one patient a day said yes to 6-month smiles? Now, I will be very realistic with you. Most practices don't do that many cases. It doesn't mean that you can't, but most practices do an average of anywhere from 1 or 2 to maybe 4 or 5 cases a month. So what if you could do that? If you did 3 cases a month, that would add about $150,000 of revenue to your practice. So think about that. Would you like that? Well, let's get started. Just sign up for a 2-day hands-on course. One thing that I really try to focus on when I teach the course, and I know all the other instructors do too, is we don't want this to be 2 days of boring clinical instruction. And I guarantee you that if you come to a 2-day course, you're going to not only learn a lot, it's going to open your eyes to something new that you can do in your practice, but you're really going to have a lot of fun. One thing that we do in this course is we bring a lot of energy to the course, and our attendees seem to be very fun. They seem to be a fun group of people. The doctors that tend to be interested in 6-month smiles are doctors that want to make a change in their patients' lives. They're doctors that want to make a change in their practice, a change in their own lives, and a change in their team members' lives. So, you affect a lot of people's lives every day. You affect your patients' lives, your team members' lives, and in effect, you'll affect your own lives. So you can make a big difference in a lot of people's lives by taking this 2-day course. Let's look at some of the upcoming course dates. And by the way, if you're wondering how much it is, the tuition is now only $1,400 to get started. So think about that, $1,400 to get started with 6-month smiles. So again, if you add up $1,400 for one doctor, let's suppose you bring 3 team members. That's about $1,000. So now you're at $2,400. If you invest in the supplies and the materials you need, which, by the way, you'll get a great discount on that when you come to the course. All in, all total, everything, A to Z, you're going to be into it for anywhere from, like I said, $4,500 to $6,000, including a little bit of marketing expense. Once you get a yes for your second case, you are profitable. So that's all you got to think about. All you need is 2 to be on the plus side. So let's take a look at some upcoming dates. Of course, if you're eager to get going, and wow, Houston, Texas, even though they've been affected by the hurricane, they're still open for business. And wouldn't it be great to go to Houston and give them some business after Hurricane Harvey came through? So you could go to Houston in a couple of weeks and take the 6 Month Smiles course right away. If you need a little more time, I would recommend you think about Chicago or Miami. And those are 2 courses that I'm teaching. The courses that I'm teaching, I have highlighted in red. So I will be in Chicago, November 3rd and 4th. I'll also be in Miami, December 8th and 9th. Now, Miami, of course, they just got brushed by Hurricane Irma. So again, if you want to do some good to a community, bring yourself and some team members to Miami, and let's support an area that's been devastated by a pretty vicious hurricane. So we're going to be in Miami in December, and again, Houston in a couple of weeks. I want you to really strongly consider going to one of those 2 courses specifically, just to give them some business. Now, if those courses and dates don't work for you, there's always Chicago in November. It's still not too cold in November. You can still enjoy the city. Also, Denver in January, Las Vegas, I will be there in February, right before my wife's birthday on Valentine's Day. And then, of course, Boston and Seattle coming up in March and April. So there's really a date and a course for everyone here within the next 6 months. So I want you to strongly consider getting this started in your practice. So let me share something else with you. Every month that you wait, if you were to have started 3 cases per month, every month that you wait is going to cost you about $12,000 to $14,000 per month. If you do 3 cases a month at $4,000 to $4,500 a case, every month that you wait is going to cost you at least $12,000 to $14,000. Every 3 months is going to cost you $36,000 to $50,000. So think about that. How long do you want this to cost you? How soon do you want to increase your revenue in your practice? So again, I just want to encourage you to just take the leap, do it now while you're thinking about it. Go to seminars@6monthsmiles.com for details on how you can get registered. I believe also that if you go to 6monthsmiles.com and click on the I'm a Doctor at the top right of the screen, you'll be able to see how you can learn about the course and you can register online. So with that information, I hope this has been helpful for you. I know I went a little bit over time. I've always been accused of loving to talk. So with that, I'm going to turn it over to Stephen. And Stephen, I'm happy to answer any questions.
Thank you so much, Dr. Bowman. We had a great group here tonight. I did not see any questions come through as of yet. If you joined us a little bit later, there is a question tab on your widget. Please feel free to go ahead and type that in now as we come to the end of our webinar tonight. But I did want to make one more offer to you. There's my email address right there. It is sncontrera@6monthsmiles.com. And if you want to send me over an email in the next couple days, I will give you a deal better than the $1,400 for the course that we saw on the previous page, and we'll get you signed up. There are additional courses booked for 2018. We just simply couldn't fit all the new courses that we have booked on the slide. And if you have questions about things upcoming in your area, maybe in Q3 or Q4 of next year, we can answer that for you too. So please send me an email at sncontrera@6monthsmiles.com, or you can use that seminar email on the previous page. All right. Well, Dr. Bowman, I think you covered it very clearly tonight. So we did not have any questions coming in. Anyone who has one after the fact, please, you can always email me and I will direct that over to Dr. Bowman. He'll be happy to answer that for you at a later time. But why don't we go ahead and wrap it up? So, Dr. Bowman, thank you so much for your time this evening and walking us through this 6 Month Smiles info webinar. And to our attendees, thank you so much for spending your evening with us. We really would love to see you at one of those upcoming courses.
Thanks very much, Stephen, and everyone who stayed on today. I appreciate that. Looks like we didn't lose anyone. That was fantastic. So again, I want to invite everyone to consider attending a course soon, and hopefully I'll see you there.